Okay, I'm going to ask Bernard Gloster, who's the Chief Officer here for the Midwest, and is also, get the full title right, the Interim Head of Operations and Service Improvement, Services for Older People. I think Bernard has the longest working title in the HSE. We were just reminiscing about our old days. We worked together in childcare, so we were saying how things have come back and come full circle again. So I'm delighted to ask Bernard to formally open this seminar and to speak to you. All right.
Morning. Thanks, Tim. The long title will hopefully be dissolved next month, and a new appointment has been made for the National Older Persons Services, so I was happy to assist for a while. I think somebody woke up one morning and about 6 months ago and decided I just wasn't busy enough as a chief officer. So in that context, I've had a lot of contact with the National Safeguarding Office, but ironically, I've always had a lot of contact with the National Safeguarding Office since its inception, because it has always been based here in Limerick, and I have, for the majority of my career, when I wasn't working in social care, I was a senior manager in the health service here in Limerick and still am. And so we hosted the National Safeguarding Office here, and indeed many of you in this room will remember Pascal Moynihan before Tim, and Pascal is now the head of social care here in the Midwest, and he sends his good wishes to you. So whether I'm here as the chief officer or the interim whatever national lead for older person services, either way I'm delighted to be here, and of course being a Limerick man I'm particularly delighted to welcome you. Tim made a bit of an effort there, but Tim, you'll find him on Twitter regularly supporting Tipperary, and while I'm a Midwest chief officer, which includes Tipperary, I'm very much from Limerick. So you're welcome to the home of the Liam McCarthy Cup, the home of Munster Rugby, and the beautiful views. And for those of you who aren't familiar with the city or perhaps haven't been here for some time, a conscientious choice was made in Limerick over the last 10 to 15 years to turn the city back towards the river. And you can see the beautiful views that are out here this morning, and if it's dry later on and you get 5 minutes just even to walk along the strand there, it certainly is. It is beautiful. I can remember a time when the city had its back to the river, and it was very much an industrial part of the town. So you're very welcome to this historical place. Safeguarding, I was wondering what might be the best context in which to address you this morning, and I suppose the first thing is to say, I think for you as the professional safeguarding community of the HSE, both the social work staff and the administrative support staff across the 9 community healthcare areas of Ireland, I think it's extremely encouraging that you take of your own initiative and take the time to work with Tim and the team in the National Office to come together and to devote some time, 2 days out of the full year isn't a lot of time, but to devote some time to press the pause button, to stop, to reflect, and to look at the different ways that perhaps we can help you to build on the work that you do, and that indeed you equally can challenge us as an organisation and as a health and social care provider to focus on the priorities as you see them based on your experience. I've no doubt there are some people in this room who remember the days of what we used to call just a little over a decade ago elder abuse. And I suppose if I were to talk about safeguarding in the context of running a health service, it's of no surprise, and it's not unique to Ireland, and I think Margaret Flynn will reflect this later on, it is of no surprise and not unique to us in any way, that very often responses to issues like that in the safeguarding agenda, they might be well intended and planned and part of our overall development, but they do tend to get expedited in the context of a crisis situation. Those of you who worked in childcare and child protection in Ireland, as Tim and I did more years ago than I care to remember, will remember the very early days of the Childcare Act of 1991 and the rather slow and deliberated pace around its implementation. And then in 1993, like a bolt out of the blue, came the Kilkenny incest investigation, followed by the West of Ireland Farmer case, followed by Madonna House, and followed by so many successive inquiries, all of which draw the attention of public discourse back to the challenge to the state. What are you doing? Why is this happening? What is this about? And so a fairly significant and enhanced rate of development took place throughout the 1990s. And indeed, if you read and reflect on some of the discourse today, you still see that those services in childcare and child protection face many similar challenges, but perhaps with a somewhat more developed system. One of the things that strikes me, now that I manage the full range of health services, one of the things that strikes me is that the same thematic, different context, but the same thematic concerns around protection and safeguarding arise and face us in the mental health arena. They face us in the arena of services for older people. Ironically, the focus tends to be on people in care, when in fact, many of you know there are many at home. And now the exponential growth in safeguarding concern and focus on the disability sector. And of course, that's not something that just happened. That came with the concentration of regulation for the disability sector in 2013. So there are many different imperatives that drive us and that rightly drive us to respond. And then at the same time, there is that need to pause and reflect and to stand back from the reactive, to stand back from the palpable anger that occurs in the public space at the time of very difficult stories, and to look at the focus of safeguarding in that proactive way that all of you as professionals want to do. And for me, that's very much about creating a culture of safeguarding, not a culture of fear about just preventing the harm, but the culture of care within which we know that attention to positive disposition to people in our care, attention to being an outward-looking organisation, attention to being transparent and to being open, particularly about the challenges or the problems that we face or the shortcomings we have. That is part of the culture that ultimately leads to safer and better services. Are they ever the perfect? I'm not sure in the context of human interaction and the nature of what we do in the provision of services that perfection has been defined. But certainly for me, there are two sides to the coin. There is the culture and disposition that everybody working in health and social care services needs to develop and inherently believe in for themselves as professionals, regardless of their job, and that applies to me as a chief officer as equally to anybody else, towards those people who are more dependent, who are more vulnerable and more in need of our attention about their care and about their fears and about their anxiety as well as about their practical circumstances. And then on the other side of the coin, yes, there is the need to have a service that is responsive and has the capacity to be reactive when we do hear about, when we do come across and when we do encounter the situations where things have gone wrong, quite frankly, for people, where they have experienced a type of trauma in their lives, regardless of the categorization of what might be considered the abuse that they might have experienced or might be experiencing. But for them to come from that experience challenges us as healthcare providers. The other really important part of the debate in recent years, of course, has been about our authority to intervene in the lives of vulnerable adults. There is no doubt the statutory base for our authority to intervene as a state in the lives of children, now gone from the health service, but we still serve a lot of children, but now gone to the separate agency TUSLA. There's no doubt the legislative base is quite strong and has been quite worked on. The legislative base for other care groups, for people be that service users of mental health services, users of primary care services, users of service for older people and users of services for people with disabilities. The legislative base around vulnerability is somewhat perhaps a way off where some of the commentators would say that it needs to be. I've no doubt that in turn will develop and continued attention to it will probably demand that the political system and that society responds to that in some way. My view of that is very simple. In some respects, the legislator will do what the legislator needs to do. And in the intervening period, we have to do the best we can with what we have in the space where we are and in the space where we find people. You will hear reference, I'm sure, over the course of the 2 days, and I'm sure you have done over the last number of months, about the revision of the HSE safeguarding policy. and the attempt to move to a more expansive policy that challenges us not just on the resource context, but it challenges us to think about all of the people we encounter in all of the situations we encounter them. There is no disputing and no denying that the particular focus in December 2014 on social care was again driven by another very serious and adverse public event, that being the now well aired story of Bungalow 3 or Satracta. And that drove a particular agenda in December of 2014, and so it concentrated a focus. And yet, everybody in this room knows that our focus is much wider than that. The lens through which we encounter people and through which people need us is much wider than that. And we will have to continue to focus on that in ways in the future. Not least, of course, that presents us with the growing issue of the resource capacity to do that. And I think one of the striking features of you as a profession, those of you who are employed and work full-time in safeguarding, one of the striking features of recent years has been, in my experience, the relatively positive way in which you have balanced that requirement to respond to the individual situations that are presented to you. And at the same time, you've attempted to articulate, and I think you've been quite successful in articulating, that if we are going to expand our formal safeguarding activity right across the spectrum of what we do in health and social care, then of course that brings with it the question of resources and personnel and capacity to deal with that. The next 2 days, you get the chance to reflect. You get the chance to not just have inputs given to you, but you get the chance to make an input. You get the chance to contribute in the workshops. And all of that forms part of what is, in my view, the developing, the rich, and the very appropriate discussion that is safeguarding. That is safeguarding in all of its forms, in all of its constructs. Because ultimately for us, when I stand back and reflect on the work we do as a HSE, we are the state, and we provide such a vast range of services to people who are vulnerable in so many ways. And that could be in our emergency department, and it can be in a GP surgery. But we have to continue to develop an increased awareness and a heightened, appropriate response to those circumstances. And that's what brings me back to the culture every time. Perhaps the best thing I can do in welcoming you here today and in wishing you well over the course of the 2 days and in the course of the work you do, perhaps the best thing I can do to conclude is to say to you, my experience of the safeguarding service as it has grown and developed as a chief officer in this area, and I've been managing the Midwest now for over 8 years at this stage, my experience of it is one that has been very positive. My experience is one that it has been very professional. I haven't heard much contradiction of that anywhere from any of my 8 chief officer colleagues. Yes, of course, there are pressures and there are demands, but the experience of the professionalism of the service and the willingness to find ways to improve has been something that is, I think, quite remarkable when there are so many demands and so many pressures beyond the scope of perhaps what any of us believed when we first started a formal safeguarding service. So with all of that, it does present me with the opportunity to sincerely say to you on behalf of the organisation and on behalf of the chief officers and on behalf of the national leadership team myself, thank you for what you do. Thank you for what you do every day. There is no doubt it is recognised and recognisable that there is a pressure and there is a demand and there is a struggle sometimes in what you do. And there is no doubt that within all of that, there is such a wonderful emerging and developing service that is responsive, that is attempting to be responsive, and that ultimately is down to you, whether you're responsible and working in safeguarding in West Cork or inner city Dublin. Thank you.